Fibula. The fibula, or calf bone, is the slender, long bone located on the lateral side of the lower leg, running parallel to the larger, weight-bearing tibia. The slender fibula lies posterolateral to the tibia and is firmly attached to it by the tibiofibular syndesmosis, which includes the interosseous membrane. The fibula has no function in weight-bearing. It serves mainly for muscle attachment. The fibers of the tibiofibular syndesmosis are arranged to resist the resulting net downward pull on the fibula. The distal end enlarges and is prolonged laterally and inferiorly as the lateral malleolus. The malleoli form the outer walls of a rectangular socket or mortise, which is the superior component of the ankle joint, and provide attachment for the ligaments that stabilize the joint. The lateral malleolus is more prominent and posterior than the medial malleolus and extends approximately 1 cm more distally. The proximal end of the fibula consists of an enlarged head superior to a small neck. The head has a pointed apex. The head of the fibula articulates with the fibular facet on the posterolateral, inferior aspect of the lateral tibial condyle. The shaft of the fibula is twisted and marked by the sites of muscular attachments. Like the shaft of the tibia, it is triangular in cross-section, having 3 borders, anterior, interosseous, and posterior, and 3 surfaces, medial, posterior, and lateral.